Thank you for joining. The program will begin shortly. Good afternoon, everyone, and thank you for joining us today for Growing Your Provider Network, 8 operational tips you need to know with Medallion. We are excited to hear from our speakers. Before we get started, we'd like to cover a few housekeeping items. All attendees are and will remain in listen-only mode. We will be taking questions at the end of the presentation. Please submit your questions at any time via the Q&A function, not the chat, as it is easier for our speakers to view and answer. We are recording this webinar and will make it available on the ATA website within the next week. And finally, as this is a public event, we remind any media on the line that this webinar's content is to be considered background only. Thank you, and I'll turn it over to Carla to get us started.
Hey everyone, thanks so much for joining us for our webinar today. My name is Carla. I'm on the marketing team at Medallion, and I'll be your moderator for today's session. Like Ashley mentioned, feel free to put the questions in the Q&A, and our experts will get to them at the end. For those of you who aren't familiar with Medallion, just a quick background on who we are. We're the first solution built from the ground up to help healthcare organizations rise above regulatory complexity, and we help you offload provider operations to a single unified platform. With that, I will kick it to our presenters so that they can give you some quick introductions before they dig into their operational tips. Merritt, why don't you kick us off?
Hi, everyone. My name is Merritt Miller. I'm the director at Medallion. I've been here for around 2 years now, and I've helped grow our licensing team from around 15 to 90 plus team members. I've been in the licensing industry for around 5 and would consider my expertise nursing and physician licensure. And with that, I'll pass it over to Allison.
Allison, you're on mute.
Of course I am. Hi, everyone. My name is Allison Hennessy, and I am the Director of Solutions Architect within Medallion. While I'm the newest member of the Medallion team with just a couple months under my belt, I've been in the credentialing, contracting, provider data management space for over 15 years. I am here to support our teams, including our sales team, to help find best solution for our clients. And Katie, I'll kick it over to you.
Thanks, Allison, and thank you for taking one for the team with the mute there. Hi, everybody. I'm Katie. I'm our Senior Director of Operations, and I focus on credentialing and then our intake team. I've been in the tech-enabled credentialing CVO space for about 6 years now. So I focus a lot on how we can enable process to move faster while remaining compliant and doing all the things that we still need to do.
Cool. With that, I will kick us off.
Awesome. So the first thing that we wanted to do today is kind of define what we're talking about. You know, in healthcare, everybody can be talking about different things while using the same words. So here, when we're talking about provider network operations, we're really thinking about the journey that a provider has to take in order to actually get to do the work that they want to do. So that's being onboarded, getting an actual license, becoming enrolled with a payer, going through a credentialing process, and all of those different pieces that are involved in that. So there's a lot of moving pieces there. And so we're going to kind of touch on each of those as we go through. And so this is kind of all of these are the phases that we're going to go through as we discuss here. And so as a little spoiler, you're going to get 8 tips for each of these segments versus just 8 tips overall. So get excited. All right, so the first piece that we're going to tackle here is provider onboarding. So this is sort of the core of any operational workflow. You have to get providers' data into the system in order to do anything with it at all. So without having accurate and complete provider data, and so what we'll also say a lot to do another defining moment, is a provider profile. So that's kind of how we think about it at Medallion. It's you have your whole profile of information on that provider. You can use that in different ways. So without that being complete and accurate, and in the case of, credentialing, compliant, you can't really do anything else with it. So this requires, active engagement from your providers, and it's really important that they feel supported and heard throughout that whole process. It'll be a lot easier that way. We'll kind of dive into each one of these tips in the next few slides. All right, so the first thing here is over communicating with providers. Communication is super important here because providers are hearing a lot of things all the time. Their focus is split between a few different things. And quite frankly, what we all really want is for them to be able to spend most of their time focusing on actually providing care versus on all of these administrative things. And so in this regard, they really want there to be more transparency. They would like advanced warning, and they also expect a lot of support when they're moving through these more sort of administrative operational parts of the process. So it's important to tell them what you're doing and like when it's happening, why. If you're trying to get them licensed in new states or enrolled with new payers, it's also really helpful to that they have a point of contact, like one person or one place where they can go to get information on all of the things that might be happening, because they probably have a lot of questions, especially if this is, the first time that they're being licensed in multiple states at once or enrolling with multiple payers. There's a lot of stuff going on there. This is, again, communication, super important. So digging into a specific piece of that is communicating the why to providers. Like I said, the most important thing to most of them, and what is probably the most important thing to most of us, is that they're actually able to provide care. So being able to explain to them, yes, it is going to take some time to get licensed in a bunch of places, and we're asking you for a bunch of data that, like, some states want you to tell them where you went to elementary school, and like you might not remember, but it's really important to get that information so that you can get licensed in the states where you are able to provide care for people who need it. So being able to have like some pretty clear language for your team, for the providers, on why they need to do what they're doing and how it will actually connect to the care that they're providing will really help them have a clearer understanding of the impact of what you're trying to accomplish, and then what their role is in that. All right, so in this is one where, we talk a lot about this in healthcare, is how do we move into the digital age? Here, when we say paper, we mean both like pieces of paper and like, a Word document that you're passing back and forth between groups, or a PDF that you need to email back and forth a bunch of times. So trying to eliminate as much of this as possible can be really helpful. If there's a single place where providers can actually see all of their information and add in all of that information, that can be really helpful. In order to digitize some of this, you need to be able to teach providers how to actually use different pieces of technology in order to get everything into one place. So making sure that there are resources available to help them with these pieces of data or technology, and getting everything into the system is super important. And finally, if you can automate any of this, so having a source that can pull information in from other places and kind of auto-populate or pre-populate things for them. One thing that we definitely hear from providers is like, I've given you this piece of information 1 million times. Why do I have to do it again? And so as much as you can work to eliminate that burden, it can also be really helpful for them. And there's no way to automatically fill out a piece of paper. Another thing here, and so this kind of goes hand in hand with that, like the digital solution, is being able to tailor your asks to the providers. It can feel really attractive to ask providers for just like, give us everything you've got, and then we'll kind of use that to do different things. Sometimes that can work well, but sometimes, if you have one field on there that isn't actually required, that you're telling them is required, and they can kind of, get to the core of it and say like, we don't actually need this thing, they start to lose trust in the whole process, and they start to stop believing you when you say that you need some random piece of information that they've never had to collect before. So figuring out kind of like what the scope is that you need for the things that you're trying to get done at that moment, and kind of being able to really explain each ask can be super helpful in building trust with your providers and making sure that things get done really quickly. Another thing that can be pretty helpful for providers here is making sure that all communication is in one place. This one's also helpful for any admin teams that are out there. So if you've got, like some things are in an email and then some things are comments in a Google Doc or a Word document, and other things are, I don't know, just like handwritten notes passed around, like it can get pretty difficult to maintain clarity around what's needed and why. And also it can be frustrating to a provider who might not be able to keep track of everything and everywhere, and get frustrated if they're getting asked for things multiple times. And so having a system or a platform where you can kind of keep everything in one place and just consolidate that communication right there can be super helpful, just in making sure that everything smoothly flows through the process. Another area here, once you've got everything in one place and providers are communicating in, again, one place, it can be really helpful for teams to have an admin specific dashboard. What this will allow is for you to kind of understand the full scope of where everything is in the process. So it's a little bit easier to see what's outstanding, when you need to check in with providers, and, so you can either bother them the exact right amount or just like not too much, which is super important. And then figure out who those providers are that maybe need a little bit of extra help. So people who have been in the process for a longer period of time, people who, maybe somebody's getting licensed in a lot of states who have difficult requirements, and like they might just need a little bit of extra help because there's a lot going on. If you have all of that tracked in one place, it can be a lot easier to make sure that everybody is getting the attention that they need. And then another thing here, if you've got everything in one place, you've got your communication going strong, you know what pieces of information that you need, it can be really helpful to make sure that you're reviewing all of your provider profiles prior to actually getting started with doing any applications. So we at Medallion, we really try and front load everything that we need to ask for the providers depending on the services that they are getting. We find this to be really helpful because if we do some of it at the beginning and then some of it in the middle, some of it a little bit later, providers can get frustrated by the fact that you didn't just ask them for everything up front. And so figuring out the easiest ways to say like, okay, what are the things that we are going to need for them and how can we move as much of that as possible up front, in order to just make it so that they feel really comfortable and we have everything that they needed. So making sure that documents are uploaded are what they should be. I've heard of people sort of uploading like a blank document where there should be a resume. That's, if you find that out later, it can be really frustrating for everybody to have to circle back around. And making sure that everything is accurately answered. If the question seems weird, like it looks like maybe they selected a yes where they should have said no, check in with them and make sure that they understand what it is that they filled out. Finally, help like having a good attitude through this is a kind of a funny way to say it, but like being a champion for the process. We all know that some of this can be a little bit burdensome for the providers, for admins, for everybody kind of focused on a healthcare process. It's important to remember why you're doing all of this and kind of say like, yeah, this is the right way to do it. And this is what we're going to do. Making sure that you're familiar with the requirements so that when a provider comes and asks a question, you don't get into a situation where you say like, oh no, don't worry about that. That shouldn't be a requirement. You shouldn't need to worry about that. And then you have to come back to them and say, actually, you know what, like that was not right. And you do need to fill this in. That can kind of create some tension around what providers think that they need and like getting everything through the system quickly. And it can just frustrate people in general. And if you can remain calm and kind of be a positive force to get people through, they'll be that much happier throughout the process and with the results at the end. If you can have a partner in this who can help move things through and who really deeply understands how these systems work, that can be super helpful. You can make, and get you into the place where you need to be, where everybody is happy and licensed and enrolled and credentialed, and you're on your way. Great. With that, we'll turn it over to Merritt to talk through some licensing tips.
Thank you, Katie, for teeing up provider onboarding. Definitely want to echo what she was saying about transparency and explaining the why. When this is done, it makes licensing move so much faster. With that being said, I will dive into the 8 licensing tips now, and we'll start with a high-level understanding of licensing. So tip number 1 is to have a baseline understanding of licensing. This includes what it is and what the most common requested items by state boards are. If you don't have this baseline knowledge, providers will be skeptical and suspicious, similar to what Katie was just mentioning. At the highest level, some common items that are requested for licensure can include transcripts, license verifications directly from the source, not just a copy of the license, background checks, board certifications, references, employment verifications. This is unfortunately not exhaustive. Some states really want to know unique information, like what elementary school you went to, all the states you've lived in for the past 10 years. And by understanding licensing 101, you can build trust with your providers. They will have questions. It is not always the most clear process. Tip number 2 is to familiarize yourself with expansion strategies and really understand what your organization wants to accomplish before starting off cross-state licensure. This means researching areas with a high patient density that matches your ideal patient, understanding turnaround times differ by state and provider type, expecting board processing times to be unpredictable, and in my experience, always longer than you would expect. There's some reasons listed here. If there's a nursing strike, it's going to be very challenging to break into that state. Understanding telemedicine policies and how quickly these are changing, as well as leveraging compacts when you're able to. These following 3 tips all center around compacts, which are a total game changer for licensing. The IMLC compact, which stands for Interstate Medical Licensure Compact, is for physicians, and it requires one of the following to qualify. The primary residence of the physician must be in the SPL, and this stands for State of Principal Licensure. There are a lot of acronyms with the IMLC, so I'll try to break those down really quickly. Another way to qualify is at least 25% of their practice located in the SPL, their employer being in the SPL, or the physician using that SPL state as a place for their federal income taxes. The provider will have to submit a letter of qualification, which is called an LOQ, from their SPL, their state of principal licensure, indicating that they may practice in this compact. And the LOQ is very similar to a standard state license application. Next is the NLC compact. This stands for the Nurse Licensure Compact. It is much simpler to apply for this compact. All you need to do is reside in one of the qualifying states and hold a multi-state license there. This enables you to submit one application to turn your single license into a multi-state, and this gives you access to practice in all 37 states. There are no additional steps here. And lastly, there are other compacts that you should stay up to date on. The first one is called the PsyPact. This is for psychologists. The next one is for physical therapy compact, and the last one is for, oh, sorry, I'm going a little faster than the slide. And the last one is for the counseling compact, which is expected to open in late 2023 or early 2024. Moving out of compacts is leveraging digital fingerprints whenever possible. There are 46 states that accept digital fingerprints that we've identified, and so far these are widely accepted by physicians. To build this into your process or find a partner who has this into theirs, and understanding how long these are valid are really essential for cutting down on some of that administrative work that Katie was discussing. we really want to avoid sending out 46 fingerprint packets if we can. So this is a really helpful way to cut down on that. Next up is CE. CE is as much of your responsibility as it is your providers. You need to have a baseline understanding of their CE requirements, and you need to support your providers in completing those requirements to make their renewal process a breeze. Some states have overlapping requirements, so leveraging a tool that takes this into account for providers with licenses in multiple states saves them significant time and work. They also really appreciate a clearly defined view of what they are required to do, and this changes all the time. So it's really important to ensure this is set up properly and the providers are trained on how to utilize it. Last but not least, don't miss renewals. You always want to track expiration dates. If you're tracking it in spreadsheets, just know that there's going to be an element of human error, and there's no true way to automate this. So you'll need to keep multiple people reviewing and keeping track of that sheet. And you want to also keep your providers updated, so spreadsheets can sometimes make that difficult. When you have a platform, it's really easy to put renewals on autopilot, receiving a notification and giving visibility to both you and the providers of licenses that are coming up for renewal.
And Merritt, we actually did get a question about fingerprinting. Okay, so how do you handle repeated fingerprint requirements for each state?
For this one, if you partner with a vendor that accepts digital fingerprints, that would be my tip here. And when I say digital fingerprints, they are taken digitally, and then you can print them onto the appropriate cards for each state and mail them out. So it's one time of the provider going to get their prints, and then 46 times someone is just printing and sending it out versus resending them.
I guess that's the answer to the third part of this. Do providers have to get new fingerprint sessions for each future state credentialing?
Absolutely. If you are not working with a partner that has the automated way of doing it or a streamlined version with the digital prints, each board does require fingerprint copies. So the best way is to have the digital route.
Perfect. And then one more in here. Do you partner with or compete against IML? I'm guessing this is IMLC, which only covers 39 states.
We definitely don't compete against the IMLC. We love working with them. They're an excellent partner and really cut down on a lot of the administrative work. However, there is still work to be done with the IMLC. Once you qualify into it, you have to apply to every single state and get accepted into it, and that can come with additional forms and addendums for each one of those.
Awesome. Thanks, Merritt. If you have any other questions about licensing or provider onboarding, just make sure to throw them in the Q&A. We will move on to payer enrollment.
Awesome, guys. Thank you so much. Those were really great questions. And thank you, Merritt, so much. Every time I hear you talk about licensing, I feel like I learned something new. So we are going to be talking about payer enrollment and 8 operational tips that I feel that are very important to understand around the payer enrollment scope and how to operationalize things. So tip number 1, just like on the licensing front, is really just to understand payer enrollment and what exactly is expected of you and your provider. I recommend doing as much research upfront as possibly can, partnering with your contracting contacts as well to just understand exactly what is needed from a payer enrollment perspective. Both provider and organizations can enroll with payers, and common items that will be requested from you and your provider are basic information such as the name and NPI, highest level of education, work history, supervisor information if we're working with an NP or a PA, depending on the state and what their regulatory guidelines are, board certifications, existing licenses, and documents such as a resume. So everything that Katie talked about up front with how we onboard our providers really does trickle down to every single process within what we're talking about, from down to payer enrollment. So having clarity on what you need. So along the same lines of tip number one, you really need to have clarity of what you're looking for. So if you're looking to get into networks and get reimbursed by payers, you're looking for payer contracts. If you're looking to allow your organization to bill for services rendered by your group providers, you're looking for group enrollments. If you're a provider, if you are a provider or a group and has existing enrollments, but you need to make updates to an address or location, that's just a simple demographic update, which is always the best possible process. And lastly, if you're looking to enroll a provider with a payer, that's going to be straight payer enrollment. So ensuring your payer contracts are established is the first and most important part of this process. Ensuring that you have actual payer contracts established and that they're executed. If you don't, you can't truly enroll a provider and link them to your group. Payer contracts are what establish those services and will help with reimbursement and understanding the rate for what you need from within that area. This process can be time consuming and requires a lot of back and forth, but it pays out hand over fist in the long run. I know within my personal experience, having seasoned contract provider or contracted teams has been instrumental in understanding exactly what the process is, how long it's going to take, and having that expertise to do the negotiation for you. So again, this is very much similar to what Katie was talking about, as well as Merit, just understanding your contracts up front and gathering as much provider information as possible is going to be key in your success for enrollment. Before you can do anything, it's important to do discovery, just in knowing that that's foundational, into knowing exactly what you need to do next, whether it's a demographic update, it's an actual enrollment. If you need to do anything with a payer, just know that building those partnerships is fundamental and key. Taking time to get the application right is by far one thing that I stress to any team that I've ever managed. If you don't know something is wrong until it's denied, that can add a lot of extra time onto the submission and time to get the provider's approval date. So first and foremost, make sure that you are applying to the correct sections, that you have all of the group information on hand that's necessary, and your provider information. And make sure that you're selecting the right side of the payer application, depending on the provider, if it's behavioral health or if it's medical. So tracking every step of your workflow, again, extremely important. Building out a dashboard to give you exactly visibility of where your requests are and where they are to be completed, define clear and consistent statuses to your team, and clearly communicate to the providers when payers request more information or just where they're at in the process is instrumental to the communication that Katie spoke about earlier. And lastly, always document why the provider was declined. So if there's something wrong, closed panels, maybe there was something within the background that may have triggered something from the past, always know that you need to be very transparent with the what's and the whys for the provider so they know exactly why something may have been closed out for them. And while we always say over communicate, unfortunately with our payers, we have to say that we need to kind of back off a little bit, which seems counterproductive sometimes, but it's true. We need to not over engage with our payers. We want the enrollments to move as fast as possible, but payers have specific workflows. So it's best to lean into their timelines, follow up accordingly. For example, if they say it's going to be 30 days for an update, contact them on day 31. Never contact them on day 15 to see where they're at. Whatever you do, just don't give up or get discouraged. You have to work with the payer, create those relationships, and just fully understand that they're doing the same job that you are too. So it might take them just a little bit of extra time, but we do want to push them as much as we possibly can to get favorable effective dates, just in a reasonable balance. And for our last tip, I'm going to hand it over to Katie.
Awesome. So the last thing that you can think about here within the credentialing space is exploring delegated agreements with your providers. Payer enrollments tend to take 90 to 120 days. But if you go down the delegated credentialing route, it can actually go a lot faster. Sometimes we see like around 30 days is what we say. So just to set a definition here, just so that everybody's on the same page as usual, we've got enrollments, and then we have delegated credentialing, where that process of actually doing the primary source verification, sending the providers through committee, et cetera, is all delegated to you as a provider organization. So that can make it a lot faster because you're totally in control and you have the transparency into the process yourself. There's some things that you need to do first in order to get there. Usually you need to be around 100 providers in your network. You have to have already worked with that payer. Like, they're not going to trust you generally if they've never worked with you before. And so they want you to have been going through that enrollment process for a bit already. And then you're going to have to get set up with actual credentialing, like policies and procedures and process, and start running people through a committee, which we'll talk about in a little bit here. There's a lot of, you need to be able to follow the right guidelines. So most provider or payers require that you're following the NCQA guidelines. Whenever anybody starts talking to us about delegated credentialing, we always recommend that you purchase the set of guidelines for NCQA or URAC or whatever it is that the payer that you're working with is looking for. Getting NPDB set up really early can help you in the process, as well as your committee. Those things are really important because they can kind of take a while, and you don't want that to be a blocker for anything else that you're working on. So usually if we're working with someone who says that they want to go delegated, we say, okay, buy the NCQA policies so that you have, or standards so that you have them, get your NPDB set up because that might take a while. Make sure that you have a committee of people who are ready to go, because if you can't get your providers to agree to be on the committee, you're not going to get anywhere with delegated credentialing in the first place. And then the last thing here, you have to, put your policies together in the first place. Policies should tell you how, should kind of give you guardrails to stay within, but you don't need to make your policies so hyper specific that it's impossible to be flexible within them at all. Account for different scenarios that you might run into within your credentialing process. And also you should be okay with updating your policies if things change. So the NCQA usually releases new guidelines. That's an area where you have to update your policies. You might start partnering with a new CVO who has technology that can enable you to move faster. Don't create a world where you're hemmed in by an adherence to the way that you've been doing things for a long time that doesn't allow you to become more efficient. And so kind of, don't go crazy and change everything all the time, but allow yourself that space to kind of do things that are can help you out in the long run. Cool. And with that, we'll dig in a little bit more on credentialing. So again, when we're talking about credentialing here, we're really talking about the delegated credentialing. A lot of this can also apply to direct credentialing by payers, but that's kind of the space that we're in here. We do know that payer enrollment and credentialing, delegated credentialing, can all be called credentialing. Also, licensing can sometimes be called credentialing, but that delegated or direct credentialing as it pertains to payers is really where we are focused here. All right, so with all of our topics here, effective communication is also super important for credentialing, and making sure that providers are informed at all times during the onboarding process of what's going on. Introducing the credentialing process. Some people may have never worked in an organization who does delegated credentialing, and so they might not be familiar. If you're working with the CVO, make sure that your teams know who the CVO is so that they're not just like getting random emails that they don't understand from someone else. And generally just make sure that people understand what's going on and what their pathway is to be able to see patients and bill for them. And the next thing here, we talked about this a little bit, but being NCQA compliant is just a really good place to start. If you're at an organization and you're thinking about delegated credentialing, again, like buying those standards, setting yourself up so that you're following those rules is usually the direction you're going to want to go in. Most, if not all, of the big payers have their credentialing centered around the NCQA rules. If not, it's URAC, and those are generally fairly similar. And so if you kind of understand what that looks like and what will be required from your organization in an operational perspective, and like for the overall process of putting together credentialing, you'll set yourself up for success early. The next piece here is establishing a strong committee. And so the committee kind of comes in both at the very beginning of the credentialing process and the very end. So they're the ones who are going to, you'll have to set up the committee so that the committee can then approve your policies and procedures, provide oversight over your whole organization or your credentialing organization, and really step in and just be like the experts in the room on a lot of that stuff. So you're going to want to establish a strong committee. Having a committee that's representative of your provider network and inclusive of the provider types that you work with can be really helpful here. You want people who are able to speak to the issues that the providers who you're working with may present as part of that process. We usually recommend that you select an odd number. That seems like sort of it could be like a silly little logistical thing, but it can be really helpful because you can sometimes have ties and you just don't want that. It is also really helpful to try and eliminate any potential bias that could be consciously or unconsciously formed. You don't want to have a committee that's all one specialty or all one gender. That kind of, you can see that sort of play out sometimes in committees, and it's really helpful to try and make sure that your committee is representative of the people who are actually moving through it so that you don't run into any issues around an unconscious or conscious bias. The committee also, while it's not a major time commitment, you do need providers to be bought into the fact that they will need to spend some time with this group of people. Typically, for most committee members, it's like an hour a month at most. Sometimes you get a little higher than that. But generally speaking, making sure that they understand that's the kind of thing that they're signing up for at the beginning can be really helpful in making sure that you get strong attendance going forward. And then finally, you should make sure that you let providers know whether or not they'll be compensated for their time. I would strongly recommend compensating them because that is a very strong way to get them to like have them be bought into being on that committee. You're asking them to do something that takes time out of their day, whether that's, typically it's outside of business hours. And so making sure that they understand that their contribution is valuable there is super helpful in making sure that they feel like, bought into what they're doing on the committee. Within that as well, you want to have a consistent voting program for the committee. And so having pretty clear guidelines for each committee member to adhere to and making sure that they have documentation to hold on to and reference in terms of like what constitutes something that should be accepted into your group, what is something that they should actually be denying. Having those rules be pretty clear can help you really avoid situations of uncertainty. And, they're discussing things that like a lot of times it's not black and white, but as much as you can do to make sure that there's clarity around what it is that you're presenting to the committee can set everybody up for success there. The other thing that's important here is making sure that committee members know to recuse themselves if they know somebody who you are sending through the committee. And this means like they don't vote, they don't like participate in that part of the meeting. You don't want them there while any discussion is happening. Typically people are like, yeah, I don't want this burden of being part of this discussion of this person that I know, and they're pretty okay with this. But setting that standard from the beginning can be really helpful in just making sure that everything goes smoothly and that there's not any kind of conflicts of interest involved. Another one here, we think about this a lot, is how can you automate the primary source verifications that go into your credentialing process? There's a fine line here. Manual verifications, like humans are not perfect. Technology is also not perfect as much as we might want it to be. And so figuring out some balance between those two things is super important. We think a lot about like, what is the highest level of technology that we can implement while still remaining compliant and not just like shoving things through the process because we can. So having some human review over the technology and like in automation can be really helpful. So bringing in all of the data, but then having a person look it over to make sure, PAs are always going to be board certified, for example. The system might not be able to like always pull that in. Providers sometimes aren't sure if the board cert is the same thing as the state board, is the same thing as something else. And so they may not actually tell you that information themselves, but making sure there's somebody in there who can make sure from like a credentialing perspective, everything in the file makes sense, can really help you pair that, like the human element with the technology element really well. And then finally here, another piece of around automation is thinking about roster management. So if you're in a delegated credentialing situation, the main time that you're going to be communicating with the payers who you're working with around the providers who you've credentialed is in sending them those monthly rosters. So every payer has their own format of a spreadsheet, usually, that they want to see that data in. It's usually the same data in a slightly different order. And so as much as you can work to kind of have a system that automates that. So what we do is take all the data that we have, set up some templated formats for those rosters and pull the data in and auto-populate. It can be really helpful in a world where, the alternative might just be keying in every single cell there, which just takes a lot of time and can really, set you back in terms of like being efficient in other places. We also, we try and set it up so that we can tell based on last month's roster and this month's roster, where are the changes and which of those changes do we need to report up to the payer? And being able to kind of like use technology in order to move through a lot of that a little bit faster is, hugely helpful in terms of like just getting rosters out there that much faster and getting providers practicing that much faster. So with that, I'm going to turn it over to Allison to talk through our last couple credentialing tips here.
Thank you, Katie. I honestly can't stress this one enough. Finding the right CVO for you. In my previous role, I've managed lots of different credentialing teams, and we've had outsourced partners that have lost our data, that have taken too long to process, where they've had, just different issues internally. So finding the right partner for you, while it's hard, is extremely important. Outsourcing completely can lead to inefficiencies. Managing in-house without software tools can lead to inefficiencies and room for error and challenges. So it's key to look for a partner that can have flexibility, plug into your existing team, presents to you, having to continue growth for your team. It's important to find a CVO that is a trusted extension of your team. And that's truly what we do here internally within Medallion. Of course, also having an NCQA accredited CVO is extremely important as well. So don't settle for anything less, and look for a partner who leverages the contributions of software and humans. You need the expertise as well as the experience of having that seasoned team behind you. And you need smart people to complete a competent team, not just software. So lastly, trust your gut. If anything seems off, make sure you ask a lot of questions, ask for references. It never hurts to talk to some of the clients that they're working with as well. Last tip of the day is to be open to change. I say it to everybody probably a million times a day. Change is hard. You've got to set a way that everybody has their own way of doing things, and they feel like if they deviate from that process, that it's going to be challenging or that something's going to break. But at the end of the day, you need to think what's best for your providers as well as what's best for your organization. Think of software partners as an integral part of your team, not there to take over your job. We want to make sure that from our perspective that you have somebody to lean on whenever you need some assistance. Again, an extension of your team. That's truly what we feel is important to understand as a software, as a partner. The more often you think tools and partners can work within the way that you're doing things, it'll just help support the efficiencies in the strategic way that you're looking to move as an organization. And now I think it's time for some audience questions. Carla, do we have anything additional within the Q&A?
We do, Merritt. We have a couple licensing ones for you, actually.
I knew that licensing was going to be the big one.
I know licensing is popular. Before I dive into those questions, if anything else comes up, make sure to put it in the Q&A and we'll get to as many questions as we can. We still have about 13, 14 minutes, so we should be able to get through a handful of questions before then. And then obviously, if we don't get to your question before our time is up, we will email you a reply afterwards. Okay. Michelle asks, how much does it cost for IMLC applications? What is the difference in time to get a license in multiple states versus IMLC?
That is a great question. I love IMLC questions. It's a really, really great tool in the space as it's just grown. So the LOQ that I was referring to costs $700, and that's your initial step into the IMLC. Once you've obtained that, you have access to apply to any state that is part of that compact. And those fees can range from $200 to around $800 per state, and you're paying that every single time you apply. In terms of what is the difference in time, once you have that LOQ, which can take anywhere from 30 to 60 days, when you go to pay for the other states and apply, you are looking at days and weeks of processing time and like a couple addendums versus Texas is a great example where it takes 4 to 6 months to get into Texas, and each requirement has its own addendum form. So it's a difference of months into days and weeks if you go the IMLC route.
Next question. Do tools like Medallion auto update CE requirements in real time, i.e. requirements being so fluid? I see this as a huge risk management aid.
Yes, CE requirements do change. I can't speak for any other tools, but I can tell you how we manage this. For our CE tool, we do regular audits to ensure that the credits that we're talking about and what they qualify for are accurate. Another way that we combat CE credits changing is when we're talking to our provider base about completing their renewals, we link them directly to the state board where they're listing out the CE requirements, just as another precaution to show that, you know, it's on the state board as it is right now. This is what the CE requirements are for your renewal. And then our tool leverages what credits they've already taken and how many states those cover.
Perfect. Katie, I have one for you. What are the KPIs for a successful credentialing service?
Yeah, okay, cool. What we think about a lot are is like the turnaround time of how quickly you can get through those those primary source verifications. I think that's like where most people start, because that's kind of like, okay, you're waiting on a provider to get things in. It's very hard to predict how that goes. And then focusing on getting the primary source verifications completed is sort of the area where you have the most control over. So that's where we look the most. That's kind of the thing that we report on the most heavily. Outside of that, things that I also really think are important to think about is how quickly are providers getting through the system. So can you, all those things that we talked about at the beginning, are you able to pull in their data from multiple places? Are you able to clearly communicate to them what it is that they need to be doing in order to get through the application process? Are you able to then, on the other side, get the committee what they need as quickly as possible to make decisions? So one like performance indicator that I look at around that is how many providers, when they're moving through the committee, get pended or don't get decided on within that one committee. So for that, it's important to think about like how much data are they going to need in order to make the decision, and how can we make sure that they have all of that up front. So those are kind of like the measures throughout the process that we look at. A lot of those have to do with time and moving people through as fast as possible. And the only other thing to keep in mind is quality, right? You don't want to just move everything through super quickly and forget to remain compliant, or like verify licenses when you like for people that are not right. Like making sure that you're doing everything correctly is also super important. So those are all kinds like the metrics that we track and look at within our process.
One more for you, Katie. Are there any drawbacks to delegated credentialing versus traditional enrollments?
Yeah, I mean, there are a lot of pluses. Like it's faster, there's more transparency into what the process is because you're in charge of it. I think sometimes it is an operationally heavy process in a different way than enrollments are. So if you're going through the enrollment process, gathering the data, figuring out or the application information, getting things up to the payers, waiting on all of that, that does take quite a bit of work. Credentialing or delegated credentialing takes work, but from a different set of people. So that's where you actually need your providers to be involved. There's some like compliance oversight that's necessary. And so being able to stand all of that up can be a little bit difficult, but usually you see it where it's like intensive at the beginning. And then as you go on, say for those annual payer audits, it's a lot easier overall to maintain a credentialing program than it is to wait on enrollments.
Thanks, Katie. Merritt, got a couple more for you that just came in. How do you keep up with the changes both in state law and requirements for licensing?
That's a great question. There's a couple different ways you can do this. What I always recommend is signing up for emails with some of the common state boards that you're working and assisting your providers with. A great example of this is yesterday, DC sent an email out saying that there's a new application type for DC, Virginia, and Maryland applications that streamlines it all. So having direct access where the board is contacting physicians and kind of inserting yourself in there is what I found to be the most effective way to keep up to date.
One more that came in. What states are the quickest to get doctors licensed in right now?
Another great question. Off the top of my head, Colorado is always a quick one. I think we've seen 3 days and 8 days as just example turnaround time. So if you're trying to break into Colorado, it's always a great time. And Colorado, just across most provider types, is very quick.
Allison, here's one for you. Are there any payers that are the quickest to get providers enrolled in?
I think that with payers, the delegation route clearly is always the best path forward. I have had success with Blue Cross Blue Shields on the East Coast, typically taking under 30 days. However, it's really hard to determine, it's typically based off of provider type, as well as what the time of year as well is very impactful of what their turnaround times look like.
Great. We have a couple more questions. One last reminder, if you have any more questions, we have about 6 minutes, so feel free to pop them in the Q&A. Katie, this one is for you. Do you need to be NCQA certified in order to have a delegated agreement?
So no, not necessarily. If you're trying to go after a delegated agreement, you generally need to follow all of the NCQA rules. It can be really helpful to be certified, but especially if you're working with an NCQA certified CVO, in that scenario, they will be making sure that they are doing all of the things that are NCQA compliant. And usually that's really helpful in order to say to payers, like, we might not be doing this, but our CVO is, and they've been doing this for, however many years, which is helpful in kind of, gaining a little bit of their confidence in that way. Yeah. It's always, again, I cannot stress this enough. If you're working with a CVO, if you're doing it yourself, just like buy the standards and like understand what's in there. You don't necessarily need to go fully through the whole accreditation or certification process, depending on what you're doing. But it's helpful to know kind of what's going on overall.
Great. Last question for you, Merritt. What are some common tools used for licensing?
There can be a lot of different kind of tools in licensing. For example, when boards require items, typically there's a process just in itself to request those. So some of the tools could be the transcript services. You can create an account and partner with Parchment, for example, to assist in sending transcripts from the provider school to the state board. There's also Veridoc is a really helpful tool in being able to bulk request MD license verifications. FCVS as well, if you can send a provider profile to each state, really cuts down on work for you and the provider. And yeah, I can't stress enough just partnering with some of these vendors to assist in the process.
Great, that looks like it is all the questions in there. Thank you so much to our presenters and to everyone for joining us. We are so excited to have an hour to talk to you. If you have any more questions, please feel free to drop them in the chat, and we will reply to them through email within the next couple of days.
Perfect. Thank you, everyone. Thank you to our panelists for such a great session, and thank you to everyone on the line for joining us for today's webinar. A recording of this webinar will be shared, and we invite everyone to keep an eye out for upcoming events at americantelemeg.org. The recording will be on our resources page within the next week. Thank you, everyone. Have a great day.